Hi, everyone. Thanks for joining me today. My name is Kendall Fugate-Laus, and I'm a doctoral student in the clinical psychology program here at VCU, working with Dr. Rochelle Hayes at VCU's Massey Cancer Center. And I'm here to speak with you about quitting smoking and helping those you care about quit smoking. Quitting smoking is a difficult change to make, especially when you're also managing a cancer diagnosis. Receiving good support during this time can be an important part of the smoking cessation process. The purpose of this webinar is to support you in your smoking cessation journey through providing you with information about smoking and how to quit smoking. If you're a family member or friend joining us, we will also cover some strategies on how to support your loved one during and after a quit attempt. So first, let's cover some background information about the impact of smoking. Overall, tobacco use is the leading preventable cause of disease and death. In the US alone, smoking is the cause for nearly 500,000 deaths each year and over 1,000 deaths a day. Unfortunately, this translates to more deaths across the globe, about 7 million deaths per year worldwide. In the United States, 47 million adults use tobacco. When we look at this map, which shows us adult cigarette smoking in each state, we can see that there are some differences across states. In Virginia, approximately 12 to 15% of adults are smoking. We know that because we see here, our state is this green color. So that means in a room of 100 adults, 12 to 15 of those people smoke cigarettes. That's among the general population living in the US. Thinking about cancer survivors living in the US, about 12% of cancer survivors in the US use tobacco. So now that we know that smoking is prevalent in the US and in Virginia, but we also know there are significant health risks associated with smoking, why do we smoke? First and foremost, it's important to establish that using tobacco is frequently characterized as a bad habit that is easily broken. But as Dr. Fiore, who's a leader in this field, has said, smoking is not a bad habit. It is a chronic medical condition. And people continue to smoke due to an addiction to nicotine. Nicotine is what makes tobacco products addicting. This includes all types of tobacco, such as cigarettes, cigars, and e cigarettes. All tobacco contains nicotine, and there is no safe form of tobacco. Addiction to nicotine is a chronic medical condition characterized by continuing to smoke even when aware of the negative consequences of tobacco that we previously discussed, cravings to smoke, periods of being smoke free, as well as returning to smoking after a period of remaining quit, as well as changes in brain structure and function. Given that we continue to use nicotine because of its effects on the brain, let's talk about how nicotine affects the brain. So first, in order to talk about this, we have to understand what dopamine is. Dopamine is a chemical in the brain that's involved in many different functions like movement, motivation, reward, and addiction. Dopamine is thought of as a pleasure or feel-good hormone because it's released when we do something that makes us feel good. Nearly all substances, including nicotine, increase dopamine in the brain, especially in areas that control pleasure seeking and motivation. When we are exposed to food and during sex, for example, dopamine is also naturally released in the brain. And when we smoke, dopamine is released. So, because dopamine is released when we smoke, dopamine plays an important role in smoking and why it is a chronic medical condition. So taking a look at this image, it may look complicated, but when we break it down, what this shows is that when someone smokes, nicotine quickly enters the brain and triggers the release of dopamine, which leads to feeling good. This sequence of rewarding events influences future behavior, such as future likelihood of using tobacco. It makes us feel good, so we want to do it again. And we know this chronic disease is characterized by periods of continued use despite knowing the negative consequences. So when we smoke, nicotine's pathway to the brain is extremely quick, making it extremely rewarding, getting that immediate release of dopamine, and thus making someone want to smoke again. It takes nicotine just 7 to 10 seconds to reach the brain when smoking, offering almost instantaneous reward through dopamine release and feeling good. So this table demonstrates just how prevalent tobacco use is in the United States relative to other substances, which highlights just how addictive nicotine is, with 58.1 million individuals reporting having used nicotine in the past 30 days. Further, this number of 58.1 million does not include the number of people that use e-cigarettes. And so this number is actually much higher, most likely, than 58.1 million. So back to this question of why do we smoke? Why do at least 58 million people use nicotine? Well, nicotine leads to alertness, feeling short-term decreases in anxiety as well, and that instant feel-good feeling. Given the immediate effects that nicotine has, it makes sense why people want to smoke and why it's hard to quit smoking. However, we also know that smoking leads to long-term negative health effects. For example, even though smoking may help with anxiety in the moment, it actually exacerbates anxiety over time. Even though it's difficult to quit smoking, it's important to know that it's never too late to quit using tobacco. Quitting smoking at any time, no matter when during your life or during your cancer care, is beneficial and can lead to important health improvements. And these benefits happen as quickly as 20 minutes after quitting smoking and continue as more time, even years, pass. So, looking here at this timeline, some of these benefits include blood pressure returning to normal in just 20 minutes. 1 day later, your risk of having a heart attack decreases. For the next year, your lungs restore function and symptoms like shortness of breath, fatigue, and coughing decrease. In 5 years, your risk of having a stroke is the same as a non smoker. And in 10 years, your risk of dying from lung cancer is significantly reduced, and your risk of developing other cancers is also reduced. For patients with cancer, quitting smoking leads to faster recovery from treatment, less treatment side effects like pain, an increased likelihood that your treatment is successful, and better quality of life, to name a few. Also, more energy, easier breathing. With all the benefits that quitting smoking has, it's important your reason for quitting smoking is meaningful to you. Some people may want to quit to save the money they spend on cigarettes or other tobacco products. Others may want to use tobacco treatment services to be involved in their care, as tobacco treatment is cancer treatment. Others may want to quit for family reasons. Whatever the reason or reasons may be, it's important that they resonate with you, as this will keep you motivated to keep at staying smoke free, which, given that this is a chronic medical condition, it's hard to do and good to have something that really keeps you going. So, if this talk were in person, I would pause for some discussion about what motivates or has motivated you in the past to quit smoking. But since we're virtual, I encourage you to go ahead and pause this webinar and think of your reasons for quitting smoking. Okay, so now that you have started to think about why you want to stop smoking, let's talk about how do you quit smoking. So just think of the word start, starting your smoke free journey, which you've already done by thinking of your reasons for quitting smoking. So the next step is to set a quit date, a specific day you will stop smoking. If you're not ready to set a quit date, that's okay. Some people quit by slowly cutting down on how much they smoke daily. So review your reasons to quit and use the rest of the start steps to cut down and feel confident in setting a quit date later. So let's break down the start steps. So S, set a quit date. When you set a quit date, make sure you choose a date that you have fun or relaxing plans for. Choosing a day that has stressful tasks throughout may make it really hard to not smoke that day. In preparation for that date, you choose get rid of any lighters, ashtrays, packs of cigarettes, or other things that might prompt you to smoke. You can replace where those things used to be with a list of your reasons to quit smoking, review your reasons for quitting, and remind those in your support system of your quit date. That's an important part of setting a quit date. Most of all, make sure to give yourself credit. Celebrate your quit date and the days that follow. Reward yourself for making this change, staying smoke-free, and sticking to it. So setting a quit date includes a little bit more prep work than just setting an actual date, but these steps, all of these steps will help prepare you for when that day comes. Okay, now we're at the first T of start. Tell friends, tell family, friends, others that support you that you're quitting smoking and need support. So we reviewed this a little bit in setting a quit date, but having people you can rely on when you're doing something difficult like quitting smoking is an important part of the process and deserves to be talked through a bit more. Sometimes it can be hard to ask others for help, especially when quitting smoking. Some may not understand just how hard it is to stop smoking, and if that's the case, it can be daunting to ask for help. So think of someone or some people that you can rely on for support. Let them know about your quit date and what you would like from them as you move forward in these start steps. One of the important pieces of this is to be specific when you're asking for support. So what do you need? So support comes in many different forms, and that's why it's important to let your loved ones know what kind of support you're looking for. For example, emotional support involves offering you reassurance and expressing non-judgmental concern, while instrumental support, on the other hand, could involve performing actions that are in service of your goal to quit smoking. Informational support is a different type of support that includes advice giving or providing information to increase knowledge. So what is it that you need? Here are some examples of how each type of support can show up in the context of quitting smoking. Focusing on what you have accomplished, not setbacks. Cravings and even relapse are part of quitting smoking. So asking your family and friends to focus on what you've achieved and asking for encouragement for sticking with it is probably going to be a little bit more motivating. If you'd like their help with planning how to cope with cravings and planning for celebrating big milestones like remaining smoke-free for a month, could be another form of support. It can be even just asking for a listening ear. Whatever support you need, let your loved ones know. Quitting smoking can be stressful, and having people you can lean on for support can be helpful. Reminding loved ones about the type of support you are seeking may prevent receiving more kind of negative forms of support from family and other loved ones. Those can kind of feel a little bit more critical, like nagging or focusing on setbacks, even if it's done with the best of intentions. Okay, on to the A of start. Anticipate your challenges. This means know what your triggers for smoking are. Triggers can be anything, any situation, any feeling, even people that prompt you to smoke. So, for example, the R in start, removing reminders of smoking, such as ashtrays and lighters and any tobacco product from your environment. This was also an important step in START, and that's because these could be considered triggers for smoking, which is why it's helpful to get rid of them. Other examples of triggers include being around others that smoke, feeling stressed or feeling bored or sad. The more that you're aware of what your triggers are for smoking, the better you can prepare to address these triggers and cope without smoking. If you happen to encounter a trigger or experience a craving or urge to smoke, which is very likely. So let's talk about some non-smoking ways of coping. If you do experience some withdrawal symptoms after quitting, there are different strategies that you can try to continue staying tobacco-free. So this includes changing your behavior, coping by changing your behavior, changing what you're doing. If you're experiencing cravings for smoking, try to remember the 5 Ds: delay, drink water, distraction, deep breathing, and discuss how you're feeling with someone in your support system. Cravings usually last for 15 to 20 minutes, which means that they do eventually pass, but those can feel like 15, 20 long minutes. So think of cravings kind of like waves in that they build and build, but they eventually crash and level out. So these strategies can help you get through that time before the craving gets to that peak. If you're feeling anxious, stressed, or irritable, try doing things that keep you busy or make you feel good, such as a hobby or talking with a friend. You can do some light stretching or deep breathing, as this could reduce tension in your muscles and make you feel more relaxed. You may also want to take a walk or think about engaging in physical activity, although you'll want to talk with your doctor before starting a new exercise program. If you're experiencing other withdrawal symptoms of tiredness, hunger, or headache, you can try some of these other strategies here on this slide, and note that it's okay to take time for yourself and take breaks as you need them. You can also cope with urges to smoke by changing your thinking. So, for example, focusing on your reasons to quit smoking to remind you that you will get through this. If you're feeling sad and thinking about smoking, you might have a thought like, why bother? What's the point of quitting if it's this hard? So, really responding to these negative thoughts by reminding yourself of your reasons to quit smoking, and responding to this thought by saying that I do have good reasons to quit smoking and I want to do everything I can to fight this disease. I've made so much progress and I can do this. You might have the thought that things might get better after I have a cigarette. Really challenging yourself and saying smoking doesn't make things better. It just provides an escape, just a brief escape. I can find other ways to help my situation get better. Just talking to yourself like this may be enough to motivate you to not smoke and give you some pause to reconsider if you actually want to smoke. Some other ways that you can cope with urges is by using additional support such as cessation medication and counseling. So, what we know is that even though it's possible to quit smoking cold turkey, the combination of using medication and counseling is much more effective in helping people quit smoking. It's hard to quit smoking with no support. Using medication alone improves quit rates, and counseling alone will provide some support for coping with cravings and withdrawal symptoms, like we were just talking about. But the two together is the best approach to quitting smoking successfully. So, a little more about these cessation medications. There are many FDA approved smoking cessation aids. They are listed here on this slide. And while some of these smoking cessation aids are available over the counter, like the patch or gum, Nicorette, some do require a prescription, such as Zyban or Chantix. If you're interested in any of these medications, make sure to talk with your doctor about what medications are best for you. Remember that the last T in the start steps is talking with your doctor. So make sure you talk with your doctor, that your doctor is informed about your plans to quit smoking, your progress, and also your questions. Okay, so we've discussed START. So you've got the tools to put a plan in action for how you'll quit smoking. So if we were in person, I'd provide this handout and some time to complete it. So if you'd like to pause and write this down, please feel free to do so. But I encourage you to work on developing an action plan. So this is based on the START steps that we discussed. So writing down your quit date, setting that quit date, your reasons to quit smoking, putting those in writing, how you're going to stop smoking, and give yourself credit for doing so, especially in the first 4 to 6 weeks of quitting. Also, anticipating your triggers and how you'll cope with those triggers. Like, for example, are you going to talk with your doctor, talk with your friends and family? Are you going to take a walk? Finally, what will your next steps be to start making progress towards quitting smoking? Are you going to remove lighters or ashtrays? What's a tangible next step that you'll do in preparation for that quit date, or has that quit date passed and you're on to next steps? So I also want to take some time to review some other resources that are available to help you quit smoking and can be included in your action plan if you'd like. Or these resources will help you even create a personalized action plan. So please consult with your healthcare provider about your needs and whether these resources would be best for your journey to become tobacco-free. So here at Massey, we have the Breath of Fresh Air program, which is free to patients at Massey, where you can meet with others who are quitting smoking to get peer support. set a quit date, and learn strategies to cope with cravings and manage withdrawal symptoms. This is a program that lasts for 6 weeks, and if you're interested, go ahead and pause the video and note down the contact information here at the bottom on that last bullet. There's also the We Can Quit program. So the We Can Quit program is a free community-based service by community outreach and engagement at Massey Cancer Center, where if you join, you'll be connected with a quit coach who's trained in evidence-based methods for smoking cessation. So you'll receive a one-on-one session with a quit coach. You'll develop a personalized quit plan, which is the same as an action plan, and receive ongoing support and connection to other resources. Again, here is the contact information, the phone number. You can also go to this link and enter in your information, and they will contact you. There's also the Free from Tobacco program. So this is also a local program that provides free access to one-on-one coaching, free nicotine replacement therapy, and access to other resources such as cessation classes and a nicotine anonymous support group. Again, here is the contact information as well as a link for some more information. There's also the Virginia Quit Line, where quit coaches are available for free to provide evidence-based 24/7 support and help you develop a personalized quit plan. Again, this quit plan is kind of similar to the action plan that I had up on the screen a bit earlier. But this is a resource that's there for you 24/7. So whenever you're ready, and you can access it by calling 1-800-QUIT-NOW to get started. If you're interested in joining a text messaging program, there is the free program called Smoke Free Text. And this, if you sign up for it, this program provides you with 3 to 5 daily tips and encouragement in quitting smoking. This kind of depends on where you are in quitting smoking, what your quit date was. But it sends you daily tips, and you can sign up by texting QUIT to 47848. You can also opt out at any time. It will last for about 6 to 8 weeks. So you can also check out the smokefree.gov website, which has so many free resources about how to plan for quitting smoking, how to quit smoking, and how to stay smoke-free. Smokefree.gov also has resources also has the resource about the Smoke Free Text program, actually. So this website has information as well about apps that you can download on your smartphone that can help support you in quitting smoking. It just has so many resources. So checking out this website if you're interested in learning more. Okay, here are some other resources as well. So there are just so many great resources available to provide encouragement and support in your journey to quit smoking. And these are just a few more. So I've also linked down here below this helpful and informative video from Dr. Mike Evans that talks a bit about smoking being a chronic medical condition and strategies to quit smoking. Okay, so if you're a family member or friend joining us today interested in helping support your loved one in their smoking cessation journey, welcome. I want to take some time to review information that may help you in this process. Okay, so first, let's review what we know about support in smoking. So receiving support is a protective factor of tobacco use, which means that receiving social support is related to not smoking. So if your loved one is thinking about quitting smoking, the way that you respond and you support them could be actually very helpful in them successfully quitting. So let's talk about what that could look like. We use this word support a lot, but there's actually lots of different types of support or ways of supporting someone. There's emotional support, which includes expressions of care and empathy. So that could include giving someone just space to say how they're feeling and listening to them. There is instrumental support, which is a form of tangible assistance. So this could include driving your loved one to a medical appointment. Informational support is the provision of advice or information or knowledge to help someone. So an example of this could be the advice that a healthcare provider gives your loved one about quitting smoking at that medical appointment. While these are all expressions of support, some supportive expressions may be less helpful than others, and some may be more helpful than others. So the best way to know what is helpful and unhelpful for your loved one is to ask what types of support they need. But these are just a few examples of what could be considered helpful and unhelpful types of support. So generally, expressions that are non-judgmental and motivating are helpful for people that are making a really big change, like quitting smoking. While more critical expressions may come from a good place and are well-intentioned because of how much you care about your loved one, they just may not be helpful in supporting them in not smoking. So as much as possible, staying away from criticism may help your loved one stay smoke-free once they've reached their quit date. Addiction to nicotine means that urges to smoke and even relapse are a natural part of quitting smoking. So your encouragement could help your loved one refrain from smoking more and continue to stay smoke free. Some other things that may be helpful include participating in an activity that helps keep your loved one from smoking. So like going with them on a walk. This could be considered more of that instrumental type of support that we talked about. Or you could provide support in planning tangible ways to celebrate their quit date or important milestones following their quit date. So like 1 month of being smoke free. If you smoke, you could also consider quitting smoking yourself or ask to join your loved one's quit program, but you know your loved one best. So repeatedly checking in on how they're doing and how you can help is great support. So here are some of the examples of negative thoughts your loved one could have while quitting smoking and experiencing withdrawal symptoms, which I showed in previous slides. In those slides, we discussed ways your loved one could respond to their thoughts, but here are also some supportive messages you could respond with if your loved one voices some of these thoughts to you. In those slides, we talked about your loved one talking themselves out of smoking. So responding, if they voice this to you, responding by saying, let's take a walk. I want to take your mind off of smoking, or encouraging them to stick with it. Quitting smoking is hard, but I know you can do it. So here on the screen, these are just suggestions. These don't need to be, scripts for exact ways to phrase things. Being your genuine self and really more so the tone of these kinds of messages are things you can look out for and think about incorporating in your own ways of support if you haven't already. You can also encourage your loved ones to talk with their doctors about getting screened for lung cancer, as smoking cessation is often paired with lung cancer screening at VCU. Lung cancer screening involves a scan that helps to detect lung cancer, and lung cancer is treatable if found early. So if you're wondering if your loved one is eligible, the eligibility criteria is here on this slide. Age 50 through 80, has a 20 pack year history. That's equivalent about to smoking 1 pack per day for 20 years, and either currently smoke or quit smoking within the past 15 years. Providing support to your loved one during this time can be exhausting. While it is important to support your loved one and help them cope with stress to prevent smoking, it's also important to support your own well-being. So make sure to take time to recharge and do things that you find relaxing. Lastly, the supported study led by Dr. Hayes is currently recruiting patients. You do not need to currently smoke or want to quit smoking to participate. If you have any questions or if you know anyone else who has been treated at Massey Cancer Center and smoked tobacco in the past, please email or let them know to email our team at supported@vcuhealth.org. Okay, well, thank you so much for joining me today and for the opportunity to share information with you. If you have any questions, please do not hesitate to reach out by email.